Good afternoon, Maine. This is Chuck Ellis, and you are watching the Muddy Waters Podcast. The Muddy Waters Podcast exists to help the people of Maine better understand what's going on in the state by interviewing people from around the state and professionals and different things like that who have something to share about what's going on in our world. And today we are fortunate to have with us Alan Bean, a medical doctor who I recently had the opportunity to meet I saw a video of actually when we both happened to be at the state house testifying about protecting girls' sports. So thank you for joining us, Alan.
Happy to join you, Chuck.
Did you have any idea that you would become a TikTok star as a result of your testimony?
That's kind of funny because I've been highly resistant to joining TikTok, period. So, but I'm fine with it. I have nothing to lose, so it is a riot.
Yeah, well, I was really thankful, and I think a lot of people were. And these are the comments that I keep getting from people is hearing an actual MD speak up and say something that makes sense on these issues of boys and girls sports, transgenderism, and other things like that. It's sad to say that it's noteworthy that a doctor is saying something that makes sense on this topic, but we appreciate that you are.
You just said it very clearly. It is for it to be noteworthy is an aberration in itself.
Yeah.
Science is science, and it's pretty black and white. And how we ever got here is, I've read about the history, but it's a bit of a mystery.
Yeah, it's one of those things where sometimes I think about like how somebody could do something, and I can understand the psychological path. I can intellectually understand the psychological path, how you made this decision, you thought this, and you thought this, and you thought this, and you thought this, and eventually you got there. But I still look at it and be like, but how? Because here it doesn't make any sense. And it's hard to comprehend how somebody who knows the truth could allow themselves. There's a point at which you should have been like, okay, this is too far. This is crazy, right?
Yes, and that is why I jumped on this soapbox. There are so many issues that all of us care about, but I haven't really ever been an activist for any of them, not since the Vietnam War. But and I was a very different person in those days. But when what got me on my soapbox was what I call my Popeye moment, where I've had all I can stand and I can't stand no more. What you just described right there was when I found out what the Oxford Hills High School school SAD 17, which is Norway, South Paris, in that area, where I went to that high school. That was my hometown. When I heard what they were about to do on this gender affirming policy, and I heard that the school board was opening it up to public comment. That was it. I jumped all over it. I knew I had to go testify. And it was an interesting experience. It was about probably 10-1 against their policy in the auditorium of about 350 people. And
Wow.
it was not at all an equal representation of, and the school board heard something that night, and that's how I got involved. Was that one particular, when it struck home, it hit home.
Yeah.
It hit my alma mater, and I knew I had to speak up.
Yeah, well, I'm so thankful that you did. And did you, when you first started speaking up, were you still, because I know that you'd mentioned when you gave your testimony that you are a recently retired medical doctor. Were you still practicing at that point?
Yes, I was. Yeah,
And
I didn't get any blowback from my peers. If anything,
that's good.
I think the people who disagreed with me kept quiet, and the ones that agreed with me came forward and gave me an attaboy.
Nice.
Yeah.
Now, how long ago was that? Just out of curiosity.
Right after restrictions lifted from COVID, it was about
Okay.
2.5 years ago, maybe.
Yeah. It's hard to tell. COVID is this like really gray area. We don't know how long it lasted, but it felt forever.
There's BC and AC, before COVID and after COVID.
There really is. I think there's some funny memes and jokes from back during that time that effectively suggested that April of 2020 was a year.
It
Like
felt like it.
it sure did. That was probably one of the longest years I've ever I remember living, but it's all been crazy since then. It started. I sometimes jokingly call this period the 20s. We had the roaring 20s, and I would have appreciated that more than the 20s that we're getting here. But so if you could just, I think it would be helpful for people to kind of understand your background, what you did for your career, your expertise, all that kind of stuff, and then what led you. Yeah, I think you've kind of talked a little bit about it, but maybe a little bit about like what led you to get to a place where you were willing and needed to step up and speak up in Augusta.
Sure. Well, my career was a little different. I actually, out of high school, I pursued a career in music. I was a touring professional musician for 10 years.
Well,
And then I decided to grow up and go to college at age 30. And I, I knew I wanted to go into something in medicine. And I've always loved science, even when I was a touring rock musician. And the I fell into a job working in a rural hospital in North Florida, and fell in love with the environment. Everybody was clean. Everybody took a bath. Nobody was chasing, looking for someone to take home that night and getting drunk. It was a very refreshing environment, and I've plus it was helping people, and all of the above really struck home with me. And I realized I had spent 10 years of my life spinning my wheels, and I fell in love with medicine. When I got into medicine, I wasn't sure what venue I would take within the business, because I liked pretty much everything I studied in medical school. It was very difficult to decide my career path in medicine. And at first, I thought I wanted to be a psychiatrist because I was fascinated by twisted human brains. But I pursued that briefly and quickly realized it wasn't for me, because there was very little satisfaction in it. And that most of the patients don't get better. And half the people I worked with were almost as crazy as the people I was treating. Um, and so I changed courses. I was an emergency doc for 10 years, which is a young man's gig. And eventually, I decided that was enough, and I went into occupational medicine, which is essentially workers' comp, kind of mixed in with some primary care. And being a workers' comp doc, to put, is not what a lot of people think it is, but I enjoyed it very much, and that was the primary. That was the last 27 years of my career in medicine. Um, when, as far as what got me into this particular um, realm, was I've always been a guy who highly valued truth.
mm,
You can insult me every which way to Sunday, but don't call me a liar, because I'm not going to lie to you. It's you can tell me I'm ugly, you can tell me you hate my music, or you think I'm a lousy doctor, but um, uh, truth matters everything to me. And when I see objective truth thrown out the door for the sake of subjectivity that is frankly unwell, then I knew I had to take a stand. I had to stand up against it.
yeah, no, it's interesting that you mentioned that, because like for me, the truth and being truthful, and speaking the truth is why I do what I do. Like I'm somebody who I sometimes say on this podcast that I'm only here, I only exist because the mainstream media has decided that it wants to be a propaganda arm of the left, and that they want to spread lies. And so, because the only way for us to get the message of truth out there is through platforms like this, I mean, the main wire is doing something, but really we've got to get into social media, because the left controls all levels. And people understanding and knowing the truth and the impact that the truth has on people's lives is so important to me that I'm willing to sacrifice and try to do this because like I want to make sure that at least people have access to information that tells them what's really going on. And I was we were talking a little bit earlier because so one of the actually we'll get back to that, but so like the issue that you specifically spoke up on and where I heard you, it sounds like what you did at Oxford Hills was a little bit different, but it was in regards to protecting girls sports and spaces. But for you, it's bigger than just that issue. It sounds, yeah. So I'll let you kind of like talk about like, yeah.
That good point. It is bigger than that. The boys and girls sports is a subset of that umbrella of looking at the whole transgenderism phenomenon. If you go back about 15 years, the American Psychiatric Association referred to such things as gender identity disorder, and clearly identifying it as an abnormality. And then, under political pressure, the APA, the American Psychiatric Association, bowed to political pressure and decided to only identify gender dysphoria, which means if you're okay with being trans, whether it's the old school transsexual, well, now transgender, then you don't have a disorder. It's because you're okay with it. You're not in any kind of dysphoria over it, and it's only a disorder if you have abnormally anxious feelings about it, or it affects you somehow psychologically in a negative way, which is what dysphoria means.
So essentially what they're saying there is that there are some people who this doesn't affect them negatively.
That's what they're saying. Exactly right.
Okay.
And so a lot of protocols have been written since then that don't identify transgenderism as an abnormality. They identify gender dysphoria as a disorder, if you will, and a legitimate medical diagnosis. I don't agree with that. Not in the slightest. I mean, men dressing up in women's clothes is as old as mankind, I'm sure.
Mm-hmm.
That does not make somebody actually believe that God or the universe or fate put their soul in the wrong physical body. That is a denial of reality. That um, is transgenderism a delusional disorder? It may be, but that's one slice of transgenderism, where someone truly is denying the scientific reality of their physical being. Um, I'm completely convinced, especially by looking at the stats on the explosion of transgenderism in youth in the last 7 or 8 years, where it's gone from literally less than 1% 10 years ago to now in some school systems up to 30% identify as a different gender than their physical gender. That is an epidemic, and it's not explainable by how much soy you're eating. It's not explainable by the chemicals in our diet. It's not explainable by anything other than some degree of societal pressure, peer pressure, fad, whatever you want to call it. It's not, mental illness is not contagious. It's just not. It's genetically present in many of the mental illness diagnoses. That's a big factor. But it wasn't like our gene pool suddenly went down the tank in 10 years. It's impossible.
Yeah, right. Yeah, no, I think that's probably I mean, whatever they're saying on the left is crazy. But their critique, what they would say at this point, right, is that there have always been this many people. They're saying there have been transgender people. In fact, the same day that we testified, somebody else, some sort of Jewish rabbi, um, claimed that in the Old Testament, I don't think, obviously he wouldn't have called it the Old Testament, but in what we would what Christians would call the Old Testament, or the Torah,
Mhm.
he claimed that there were 5 genders represented in the Torah. And so
Never
they're
heard that one.
claiming their claim essentially would be that there have always been this many people, but that they just weren't like culture, like, kept them quiet and kept them in fear, and so they denied who they really were. What do you think of that?
Okay. Uh, I trained in medicine 38 years ago. Um, in those days, in medical school, nobody even came within a millimeter of just of confusing gender and sex.
Mm,
Sex and gender were equal words. They were synonymous in all medical writing, all medical teaching, up until very recently when the word gender was hijacked. It frankly is just like they've LGBTQ crowd has hijacked the rainbow. They've hijacked the
mm,
word gay. It's a word, and words do change. Etymology of words
yep,
change over time. I appreciate that, but this one is not associated with truth.
right.
It is a misrepresentation of what the word gender means. Um, have there always been people who are confused about their or legitimately have different sexual preferences? What turns you on may not turn me on. Some people might be turned on by their goldfish. I don't know. It's that is not the same issue as transgenderism. Sexual preference, sexual attraction is not what transgenderism is. Transgenderism is a mistaken belief that you're in the wrong body.
Right. Yep. Yeah, and yeah, I would agree with you. I just like to throw out some of the stuff that they say, and it's like like I really don't understand. Again, like it's kind of like we mentioned a little earlier, where it's like I can theoretically, piece together the logical reasoning that they would how somebody would come to a place where they think that this is true, but at the same time, it's so obviously not true. Um, that it's like hard to comprehend how people would see the data that you just said. In some schools, 30% of kids are identifying, I think it says, at least as non-binary, but
Right.
transgender in some way. And that's obviously crazy because they're obviously 30% of kids are not, even if you wanted to go down the line of reasoning and believe that transgenderism is real in the first place, which I contend with. I don't think that there's any evidence out there. Like you said, I remember growing up. I mean, you're the doctor, but I can talk about things anecdotally. But I remember growing up, and when I was taking tests or not filling out forms when I was going to school, that gender was not one of the things that was asked.
No,
It didn't exist 20 years ago. It was sex. That's what it was.
that's right.
I didn't like the term gender is something that was created, really and put into use in the last 20 years. Prior to that, we just used sex. And then they're claiming that we, who always just use sex, are creating these gender norms when we didn't even know that gender was a word 20 years ago. But anyway, they created it, and now they're trying to say that it's our fault that these things exist. And it's like, okay, I don't know how your brain functions, but anyway, it's just something that didn't exist 20 years ago. And I think a lot of I talk to a lot of people, and I can't tell you how many like older, like, above 40 women will make comments about how, geez, I'm really glad I'm not growing up now because I was a tomboy, and, or
Right.
I played with trucks, or, I liked sports. And these are things that they're now associating with, oh, if you're a girl growing up this way, maybe you're a boy. And they're suggesting this to kids, which one of the fun things, again, psychology is not necessarily my thing, but I did take a class, and I remember this thing about like children, especially at young ages, are very easily suggestible, right? And so
Absolutely.
if you start having these conversations with kids when they're young, and you're an adult and you're somebody who's trusted by them, and you start being like, well, maybe, it's really easy to get them to believe something that's not true, that they even would know is not true. I mean, children need us to guide and correct them. They don't need us to let them tell us what is true, which is what this transgender cult is suggesting. Anyway, that's an aside, but
Yeah, I mean, it's become pretty well known argument that the children need to be put in a separate category from adults. The human brain, especially the frontal lobes, does not fully develop until mid-20s, a little bit sooner in girls, like early 20s, and a little bit older in boys. And that is the seat of our reasoning, our personality. That's the seat of our um, really how we assimilate all the information that's in the rest part of our brains and how we are able to express it. Um, and so that is still developing. I mean, if I think back to uh, my teens, when I thought I knew everything, and realize later how little I actually knew. The As I told you before we started today, as as a Republican, there's a bit of a libertarian streak in all of us, I think, where we simply recognize liberty to live your life the way you'd like. But the problem, and I'm okay with that, if you're an adult and if you are clearly an adult and you're not um, hurting anybody else and you want to go through chemical or surgical sex gender change operation, that's your business. And I understand that. But it severely crosses a line when minors are involved. We Minors, especially when school systems pretend to act as parents, that's an absolute travesty. It's a violation of the rights of parents, and it
Yeah.
should be considered to be child abuse, in my opinion.
Yep.
Um, I got a little distracted there, but
But
getting
if it,
back,
adults want to do what they want to do, but kids,
yeah, yeah. What what did Churchill say? That if you're not a liberal when you're young, you have no heart, and if you're not a conservative when you're older, you have no brain. Um, the He was right. I mean, I used to be leaning very much the other direction when I was young. It was a product of the times as well. But now we've got young people that are a product of very different times, very different times. It's where they've taken freedom and really turned it into something freedom really doesn't mean. Freedom
mm,
does not mean you're able to divorce yourself from reality. Um, you can experiment. Kids have always experimented with their sexuality, and but it doesn't mean they end up there. Um, it's Yeah,
yeah. So, as a follow up question, like, do you have from your experience and history in working in the medical field, have experience working with people who were experiencing transgenderism, and like, what is your, like, obviously there's, like, I want to get into, because we talked a little bit about this before coming on, like the scientific side of the data that we actually have, but just like, what's your experience working with people who are transgender first?
yeah, that's a big question, and it's a very important question. When I testified in Augusta on that bill, you have to give your written testimony of what you plan on saying, which I did. I went completely off script, but they read the legislators read my written testimony, and one of the things I mentioned in there was that every transgender, every single one that I've ever had in my office as a patient, or even if they weren't officially my patient, but they were there for an evaluation, such as a school physical or a job physical. Everyone that identified as something other than their biological gender uh, had clear evidence of a severe psychological disorder underpinning their condition, without exception. And I was asked by one of the legislators when she read that, and she says, "I just read this in your report, and how many have you actually seen as patients?" And I couldn't give her an exact number, but I said in the realm of 2 dozen over the course of the years of people that had gender dysphoria or gender identity disorder, depending on your lingo. Um, and I explained to her that every single one that I saw had scars on their forearm, on their non dominant forearm from self cutting. Every single one,
Hmm.
no exceptions. Um, the They all were plagued with obvious, I mean, glaringly obvious, even to the untrained eye, severe anxiety disorders. And they asked, well, how does that affect how you treat these people? And I explained to her that compassion is a big part of medicine, whether you think the person is mentally ill or you or not. You still have to be compassionate with the people you're seeing. And I've never had a problem being compassionate with my patients. I defy anybody to ex- interview any of the literally tens of thousands of people that I've seen over the years who would say that I treated them coldly. That's not who I am. But we doctors operate in the realm of objectivity, whereas patients operate in their own subjectivity. They can think that they are a woman or a girl when they're in fact a biological male. But if a doctor, and this is where I think the AMA has totally blown it, and the APA, is that we doctors are trained to operate, make decisions in the objective realm. What do we see? What can we scientifically defend in our final assessment? So, putting that on the biological males in the female sports realm, there's several things. I was specifically asked, what would a doctor do ethically if he sees a boy who wants to be on the girls' basketball team and he has to have a high school or sports physical? And I said, well, what does he write down on the record? And I said, if you write down female, that to me is medical malpractice. That is lying. That is telling something that isn't true. Males get male diseases, females get female diseases. I've never, well, maybe twice in my entire career have I seen a female with an inguinal hernia, a groin hernia. Whereas I can't count how many hundreds and hundreds of times I've seen males get hernias. So if you're a biological male applying to be in a job or a school sport that is physically demanding, you need to have a hernia check, the classic turn your head and cough trick. And there were numerous occasions where I saw biological males who, because they thought they were a female, they refused to have a hernia check. And I told them flat out, I'm sorry, but I cannot clear you for this job that involves heavy lifting or this sport that is physically demanding, unless you allow me to do that. About half of them would say bye bye and they turn around and walk out. And the other half would acquiesce and let me do the hernia check. Um, and that's to do otherwise to me is frankly, like I said, lying and or medical malpractice.
Well, you're not doing them any favors because pretending that they don't have the biology that they have doesn't help them.
That's correct.
It still exists, even if you don't agree. It's still there.
Mhm. And if we see someone who we think has a mental illness, we as physicians have to approach that subject as difficult as it may be. That is our job, is to identify disorders and attempt to treat them as well as possible.
Yeah. So, why, like, again, we talked about this a little bit at the beginning, like about how it's like the crazy thing about the world is that like it's noteworthy that one doctor is speaking up, but what's going on with the other doctors? Why are more doctors not speaking up about this?
Fear is the word. Fear of their job security, fear from their employers. Very few doctors are self-employed anymore.
Mm,
The vast majority are in some sort of system. I worked for a large hospital system my last few years of my career, and but you know what? I was already at the point of I could retire if I wanted to. I didn't want to. I still enjoyed my job. I was still pretty darn good at it, and it was I was doing it because I loved it. And my comment when people ask me, "Aren't you afraid that you're going to get canned?" And my answer was always, "Let them try. If they want to fire me, they might have a lawsuit on their hands." And I had nothing to lose at that point. and certainly now that I'm retired, I really have nothing to lose. But
Yeah.
yeah, I mean, either we stand up for the truth or we don't. And courage, I believe, is contagious. And the more people who stand up with courage against nonsense like this, the more people will be willing to stand up.
Yeah, no, absolutely. We definitely need more people too. And so I think that this is a challenge that there are doctors out there that are listening and are afraid to speak up. Like we need you to speak up while you're. I mean, obviously it's a lot harder to do it when you're still in the system. But the reality is the system is never going to be overturned unless we push back against it. And how much good are you doing if you're not? I mean, in all reality, like there is a space where the more, like, if you operate from within that system and don't push back against that, then are you not complicit? I guess is the question that I would begin to ask, right?
Absolutely.
And so the blood is on your hands, right?
That's right. I agree. Um, if you are part of any system in any realm and you're working or ingrained into a system that has values that are contrary to what you know is true, then you're a hypocrite. Simple as that.
Yeah.
Yeah.
Yeah. So, and that's where we need. I mean, obviously, like, it was nice that you were in that position where if like they choose to fire you, you're like, all right, I don't have to do this anymore anyway. But we need more people to be willing to take those risks because again, if we lose our country to this insanity, what good is your job? That's kind of the question. Like, we have to have more integrity as people. And it's challenging, it's difficult, and it is a risk. I get it, but ultimately if enough of us stand up and start doing it, they're going to have to, like, this is a reality. This is one of the things that I think Republicans don't realize sometimes when they're in their jobs and they're like, well, it's like, if they start firing people who are openly Republican at work, who are they going to have to do the jobs? Like, we're a significant portion of the workforce are actually more conservative and agree with reality and are hardworking, right? Like, they can't fire all of us. They can fire one or two, but they can't fire us all. They wouldn't be
Yeah.
able to survive. And so this is where we need more people speaking up. So one of the other things I want you to give you some time to talk about, because it's I could talk uneducatedly or slightly educatedly about it, but I think there's more value in hearing it again from somebody who has the credentials. Although one of the fun things about the 20s, as I like to call them, is we don't trust in authority nearly as much as we used to, because authority has proven itself to be bankrupt when it comes to issues of the truth. When the entire system is pushing something that is so obviously not true, it's like, oh, the American Medical Association said that. Oh yeah, like I care. They said this too, which is absolutely crazy. So what do I care? At the same time, you being a doctor who did speak up, I think you have more of a voice, and because you've got the scientific experience and understanding. But so we talked a little bit about, like, when I was running in 2024, I should say, for state house, I mentioned about, like, not gender affirming care. I talked about transgender treatment of minors. I talked about the fact that um, that was what's the term? What am I looking for? My brain just went six different places. But that basically, I said that this was an experiment. These were experimental treatments, these like hormone blockers, and I was castigated by my opponent online for basically all these different organizations support it, and it's like it's got a long history of. It's tried and true. Essentially, we've got years, decades of research proving that this is not this is not experimental and that it is healthy and helpful. And so I wanted to see what your response was to that.
Okay. It depends on how you define experimental and unproven. If I give you certain medications that can completely block the effect of testosterone, that lovely beard you have is going to fall out. You're going to develop breasts, and your voice is going to change a bit. And yeah, you're going to become feminized. If likewise, if I take especially a child, a young child, a female, and start giving her testosterone or one of the androgenic or male hormones, um, she is going to start to grow whiskers, etc. And but she will not grow a penis, nor will you, nor will you with estrogen start to develop a vagina or a uterus. It just that ain't going to happen. That
Yep.
happens way earlier in fetal development. So yes, the medications that block hormones or giving hormones, those aren't experimental. Those are real. What's experimental is or unproven is the long-term efficacy and the long-term risks. We don't have data to support that. When you look at the FDA, as whacked out as it has been over the years at times, depending on how politicized it may be at any given point in history, um, the uh, amount of time taken to get a new drug to market was at least 5 years, and oftentimes 7 or more years, by going through a series of studies, first on animals and then on limited numbers of humans and then a greater number of humans, and gathering the data, looking for side effects. This particular type of treatment, this gender affirming care, uh, hasn't had that benefit. There hasn't been long term outlooks. And now that we're starting to gather data from looking back, we're seeing all sorts of terrible things. There are a lot of medical complications by giving these hormone blockers and or hormone in a positive way. Um, Many, I could have a list in front of me here, but um, and one of my favorites is the whole mental health aspect of it. There's more and more data is coming in that shows there is zero positive impact on the mental health of these people who decide to transition. The classic argument that the gender affirming doctors, who I really question where they went to school or who taught them, but
The pharmaceutical industry taught them, I think.
something like that. But their primary argument for the last few years was to the parents, what would you rather have? A transgender child or a dead child who's going to kill himself because you don't allow him to go through transitioning? That has been proven statistically false. That yes, there's an extremely high rate compared to the general public of suicide attempts in people who have gender dysphoria, but it doesn't get better once they've transitioned. Um, Matter of fact, various studies have shown that of mid-teens who identify as gender fluid or gender opposite of what their biology is, um, of those individuals, by age 25, various studies have shown between 60 and 90% of them are glad they didn't transition when they made the decision
Mm,
not to.
wow.
That's a huge number.
Yep.
There is no drug on the planet today that would have been approved by the FDA if you had those kinds of long-term effects noted from that drug. It would be laughable that, I mean, if it gets up to 5% potentially of the people taking a drug, then it gets what's called a black box warning, that you're taking this at great risk and you should only take it if absolutely necessary to save your life. There's a whole class of antibiotics called fluoroquinolones that have such a warning on them. They were put out as mainstream drugs and later found to have all sorts of terrible long-term side effects. So now, if you shouldn't even prescribe them unless it's a life or death situation. Um, well, the life or death does not apply in transgenderism with children. That has been proven statistically to be false, and those statistics on good quality studies is what has made. Last check, I knew 7 European countries have banned all um, trans gender affirming care for minors, and our U.S. is very much behind Europe in that regard. Europe was one of the first to adopt transgender care or gender affirming care, um, and they were ahead of us in a bad way in that way, but now they're ahead of us in a good way. They're recognizing the fallacy and the mistake they made. Um, so
Yeah, I mean, those things are just wild. Like everything, like just about everything that you just said is like crazy. So 60 to 90% of people who transition, who go through the transition, who don't go through the transition, I
Well,
should say,
either
are
those that do transition regret it, 60 to 90%, and those that decide against it, 60 to 90%, or are happy they didn't go through the transition.
right. Yeah, I have heard
Cuts both ways.
there's a lot of, like, again, the studies are really really challenging, and like a lot of people probably are aware of the study that didn't get released because it was being led by people who were trying to create a study that would be helpful for the gender cult, is what I sometimes call it. And when the data did not look in their favor, she decided not to release it because it could be used for political purposes.
Right.
So it was okay when she was going to use it for political purposes if it made them look good, because it made them look bad, because the data, just like, the reality is it's just not good. But even prior to that, a lot of the studies that I'd read a couple articles from people who are more educated in this than I am, and they were effectively saying that, like, even the studies that are sometimes cited by the doctors on the left and the people that are pushing this agenda, that say that they will say things like, whatever percentage of the people who transitioned say that they don't regret their transition. And again, it sounds like the data you're saying kind of disagrees with what they were saying at the time, but they would basically say that they're all still believe that they were in the wrong gender. They don't disagree with their dysphoria or whatever. But if you looked at their happiness, right, at the very least, all of the data suggests that nobody who goes through this is happier. Nobody who transitions is happier. And I think in particular, men who, as I've come to call it, going full boil, men who do that are the highest rate of suicide out of any of the different categories.
That is correct.
Yeah. And it's it's mostly like a number of years after they've done that, and because you just, that's not something you can come back from. You can't undo that.
No, no, you can't. And matter of fact, giving testosterone to underage or prepubertal girls has devastating physical effects down the road. Um, causing infertility, menstrual cycle abnormalities if they try to reverse it. Um, a very poor, well, adrenal hyperplasia. I mean, I'm trying to look at my list here, and realizing that a lot of this is in medical jargon that wouldn't fly, but increased risk of certain cancers.
Yeah,
Yeah,
I think there's one of the things that
bone
I've
loss.
heard. Bone loss. I was going to say, like, like, I've heard that specifically women who do these things, like in their teens, like in their 20s, they're seeing signs of osteoporosis,
Yes.
things like that. And then, but just in general, the idea of blocking something that your body is naturally supposed to do, I think every type of medication or experimental thing that we try to do in this category tends to lead to cancer, right? So, like, I remember when I was a kid, my mom was like, don't use not it's antiperspirant, because antiperspirant puts these little follicles in your skin that blocks your body from being able to perspire. And she told me that my mom is a nurse, so she told me that it was linked to cancer, right? And so I never used antiperspirant, right? And then, like, there's omeprazole, which is a drug that people take and this is just my own experience with, right? A drug that people take to basically tell the body not to do something that it's naturally supposed to do in releasing acid into your stomach, because there's a problem there and it's releasing too much acid. So tell it not to do it. And, like, the data seems to suggest that people who take that long term have a higher risk of cancer, right? So when you're taking medications and drugs and different things that are telling your body not to do something that it naturally is supposed to do,
Mm-hmm.
I think that's a category where it's just generally always leads to cancer. And so when you're doing it at such high levels and with hormones and kids, especially during that really important phase of development, it's no surprise that this is leading to medical problems. People who are surprised confuse me.
Yeah, and it's interesting. The people who tend to be left leaning are also the same group that want everything organic and natural. You know, which believe me, I'm not against natural. I'm not against
Yeah,
organic, not in the slightest.
same.
But there's a disconnect there that I don't understand. Um, you touched on something that I would like to bring up regarding specifically the biological males and female sports. And I have not heard anybody talking about this. If in high level sports, whether it's professional sports, whether it's the Olympics, it's common to do drug testing
Mhm.
to see if the performance enhancing drugs, PEDs, are being used by the athlete. Performance enhancing drugs are almost invariably androgenic steroids. Androgenic meaning they're natural steroids that are found in us males. Um, and this applies to males and females. If you're a male athlete who's taking exogenous, in other words, extra um, androgynous hormones to boost your performance, and they find out about it, you're disqualified. If a woman takes androgynous external hormones, she's disqualified from that athletic competition. Well, guess what? When a boy who's 12 decides he wants to be a female and then he wants to compete against the females, guess what? He's already had more than 12 years of testosterone influence on his bone development, on his muscular development. He has a physical advantage that is clearly unfair. And even if they haven't hit puberty yet, androgen starts to work on the fetus about month 3 in utero.
Wow.
It starts to affect the brain. It starts to affect the development of the genitals, even before 3 months. So
So that's 3 months in utero. This is
yes, first
pre-born.
first trimester, first
Okay.
trimester of pregnancy, you're already clearly becoming a male if you have testosterone around, and if you don't, you're a female. We all start with the same physical makeup as at conception, but the presence of testosterone is what defines a male. That's what changes the development. If you had zero testosterone from the moment you were conceived, you would not be a male today. You would not have the male genitalia. You would not have testicles. Um, but um, so, if we allow any biological male at any age to compete against a girl, he has a biological advantage, a significant biological advantage. Um, and this is especially obvious in high end sports, um, professional level, Olympic level, college level. Once you get past high school, where girls up through high school, a lot of girls develop physically quicker than boys. That's a very well known phenomenon. So it's not unusual to see a pretty skinny little weak boy who's a sophomore or junior in high school who doesn't develop all the male characteristics of stronger muscles and stronger bones, physical prowess until after high school, even. So there, you can get away with, to some degree, it's less obvious in the school level, the difference, but it's not at all lacking being obvious once you get past high school. In college sports, when have you ever seen a college female playing football except the kicker?
Hmm.
Um,
Yep.
it ain't going to happen. What college sports? I mean, professional level sports? No way. You know, there's always going to be a bell curve of performance ability. Could I go up against Caitlin Clark and win in a basketball game? Not a chance, because she's an exception. She's exceptionally talented female, and I'm a run of the mill guy. Who was never a great athlete to start with. But I think you understand my point of the
Yeah.
hypocrisy here. If we're going to disqualify athletes because of their use of testosterone taken externally, why would it
Right.
not be internally also a disqualifier?
Right. No, I mean it makes perfect. And again, this is a huge part of the non I don't know how to put it. The argument for keeping biological males out of women's sports that doesn't have to do with just the general insanity around transgenderism, because it is, again, it's a mental illness. It is not healthy for anyone to be encouraged into their mental illness. But a lot of people, and like, I don't want to call them out per se. I understand what they're doing. I think tactically we see this as a winning issue for a lot of people on the right, and so I think a lot of people are being clear to distinguish and say, I'm not anti-trans or whatever. And so they're they're clear, they're trying to be very clear and stick to the topic, if that makes sense. And I understand why they're doing it tactically, but at the same time, anyway, so a lot because people are trying to avoid getting into transgenderism in general, because the left has taught everybody to believe that if you say anything negative about people transitioning, it's because you're a bigot. Then they've focused on the biological differences in female sports, which is obvious. Like you said, and you brought up professional sports, and I just remember, like, years ago, there were conversations, and like people were talking about things that I knew would never happen. But I think the question was, when is a woman going to make it into the NBA? I mean, this conversation was happening like decades ago. I remember Rebecca Lobo was probably one of the most prolific female basketball players. I think she went to UConn, if I'm not mistaken. But either way, I know that she was in the WNBA. I actually think she might have been drafted into the NBA, but she never made a squad. I can't.
Yeah.
There was a conversation about a woman getting drafted, and I can't remember. Anyway, it might not have happened, but there was at least conversation about it. But like, even if she did, or was, like, we're 20 years later, nobody's stopping women from playing basketball as much as they want.
No.
They are, and we still don't have a woman playing in the NBA, and we won't, because males are biologically superior, and it's absolutely ridiculous to have women's sports if you're going to allow biological males to participate.
Yeah, I mean, professional sports are merit based.
Yep.
If you're a woman who's good enough, you'll make the team.
Yeah.
And like you said, it hasn't happened yet.
Yeah.
There's a lot of data.
Kidding? Those teams would love it. Like, it was, I mean, one of the things that proves this, going back even to the days of like bad racism in America, like the reason that African Americans started playing professional baseball was not that people stopped being racist. There wasn't a decline in racism. It was that people knew that they could take these really incredible athletes and win.
That's right.
It was, so sports is one of the most like merit-based things out there. Like, we don't care where you come from. Can you help us win? Like, that's number one. And if women were capable, they would be on those teams, but they're physically not.
When I was a little kid, I was about 5 years old. One of my grandfathers was a Southerner, and he was an absolute racist bigot, an embarrassment. And I heard him say once, when I was about 5 years old, using the dreaded N word, that the only good one,
oh gosh,
is an athlete or a dead one.
Yeah.
And I was blown away by that. I was a little white boy who grew up in Maine, who didn't even know any black people. I didn't know what he meant. It was awful, just awful thing for me to hear. And I knew then that was evil.
Well, that was a thing of that day, that everybody knew. It's just like with transgenderism today. Like, everybody knows truth. They know that people are not more valuable or less valuable based on the color of their skin, but it's who are you as a person is what makes you valuable, right? Everybody nailed it. Yeah, we all know, yeah, absolutely. We all know what the truth is with that issue, which is why us as kids, because I had some similar experiences when I was a kid, hearing people say things. I'm like, are you like, a family member, I won't, she's deceased now, but was making a comment to her granddaughter, who was, I think, unbeknownst to the family, was in a relationship with a African American. She moved down to Georgia, and she was having a conversation with her grandmother, and her grandmother makes this comment that's like, I think they should all go back to their country, and her granddaughter was saying this is their country, right?
Well,
Right, and we all know it's true. But people choose to allow themselves to buy into to falsehoods, which is what's happening in the transgender cult today. We all know that 2 + 2 = 4, and yet we're allowing people, because they're like, well, the doctors say that 2 + 2 actually equals 5. It's like, but it doesn't.
no, it
Anyway,
doesn't. When I have a discussion, I won't call it an argument because I don't generally get heated. But when I have a discussion with somebody who disagrees with me on these issues, I make it clear right from the beginning that it is not for me, and it should not be a political issue. It shouldn't be a
yeah,
right versus left issue. It should strictly be science based. And I, I've talked to 3 different school systems, and I'm soon to talk to a 4th. Um, and the um, the approach, I try very hard to not even be identified as a Republican or a liberal. I want most of my friends, many of my friends, not my closest friends, but of my friends don't know what my political affiliation is, because politics is generally avoided, and we share very similar values. Um, and that's I've told you this before, that most of my virtually all of my Democrat friends, and I've got quite a few, are have very, very similar values to us. They just have a extremely different approach on how to approach those value problems. Um,
yeah.
yeah. Uh,
Well, and I think part of it is, there's an element of, I think part of the reason that people are there, one, is that they don't really understand the nature of the problem, right? I think a lot of people um, don't believe that it's happening to the degree that it is. They're not seeing it, right? It's happening largely at schools, where if you're not
mhm.
there, or if you don't have a kid in your family or whatever, like, so a lot of people are just not seeing it, number one. And I think that's partly why people are a little bit less, I
Mhm.
think if people saw what was happening, the conversations that are leading to it, the process, I think a lot more people would be upset. But I think people, one of the things I've noticed is people in America in particular, and I was there at one point, did they have this idea that, like, yeah, crazy, wild things can happen in the world, but not here in America. There's this, like, that's, it's not, but not in my life. Yeah, that's a risk for other people, but it's not going to happen to me, and this, that, and the other. And I think because of that, they don't recognize how pervasive this problem is, and how manipulative, and I mean, the term, I remember beginning to hear the term groomer, and I felt uncomfortable with the term because I thought it was too aggressive. And now I'm like, nope, that's what it is. They're
It is.
grooming children. And it's, yeah,
Well,
anyway.
regarding your point, all of us, right and left, can tend to live in our own little bubble.
Yeah.
And we associate with certain types of people, with certain types of values. We go and so it's very easy to not see outside that bubble and not realize that what's happening out there in the world. I can tell you that as I mentioned to you, the first 10 years of my adult life, I was a full time musician. In the musical world is not exactly a realm full of conservatives, and and so the people that I hung out with were mostly completely naive. I'll give you an example. In 1970s, band I was touring with, I was the only guy in the band out of 5 of us that had any political interest whatsoever. Matter of fact, the 4 other people in the band didn't even know who was running for president in the election '76, where Carter was elected. I was the only guy in the band who knew who Jimmy Carter was.
Hmm.
And and that's what I mean about the bubble. People exist in their bubble. They have a very narrow focus, tunnel vision, and and that's okay. What really bothers me is willful ignorance, where
Hmm.
people make a decision. They're not going to listen to what we have to say because we disagree. And you see
Yeah,
that on both sides of the fence.
you do, and you see a lot of people. Actually, this happens on both sides. I think more on the left. This is usually like I'm very committed to the reality that the right is not perfect. It's far from perfect. We have a lot of mistakes and a lot of issues that we need to work on, and that a lot of the problems that exist in the left also exist in the right. But I just
Mhm.
think it's much more pervasive in the left, of the people that are willing to cut people out of their lives if they disagree,
Oh, yes.
unwilling to look at the other side's news sources and do like looking at both sides, that kind of thing. Like I think a lot more people on the right are okay to like read and read things from the other side of the aisle, although we don't do that quite enough to really understand, I think, where people are coming from. There's not enough I think I think people willing to try to look at both sides of things. I think it's hard to look at anything on the left right now because most of it's just like absolute insanity. It's all Trump is evil. He's trying to like when we it's I saw a meme recently. This isn't about Trump, but this is like one of the stupid things that's out there. And it was on like a Facebook page called Main Politics. Somebody posted a picture of women trying to get into a bathroom and somebody standing in front of it inspecting women's genitals, essentially. And the response in the at the bottom, it said, this is what all the Republicans want, essentially. It's like, no Republican wants that. Are you kidding?
No.
And that's where like some of the insane argumentation of the left is that we're going to the point is to make people uncomfortable and inspect people's genitals. It's like, no, I mean, again, people go to a doctor to get a physical. We already have a process for verifying the gender of people, that they're required to get a
Yeah.
physical in order to be able to participate in sports. But anyway, these are the tactics that are used by it's really challenging to try and look at both sides of the aisle's news sources when their side is not ever saying anything intelligent these days.
Well, one of the arguments that gets thrown in my face a lot, um, from people who disagree, is, and this happened when I gave my testimony a couple weeks ago in Augusta. One of the Democratic legislators asked me, Dr. Bean, what about intersex? What are you going to do with that? Um,
I heard
and
your response to that. Go
yeah,
ahead.
yeah. And so my response was, sir, there's really no such thing. And that, and I, because either if you have a Y chromosome, you are a male, period. Even if you have five X's and one Y, you're still a male, because that's the way the hormones work on our genital system. Um, I'd like to back up a little bit on that. What you didn't hear was my one of my wife's aunts was a nurse when she was young, and a couple of times they had babies with ambiguous genitalia where you could not tell, is this a girl or a boy, by looking at the external. And the doctor, this never happened to me, and it's no reason for it to ever happen to any doctor today. But the doctor wasn't sure, but that was before genetic testing that we could easily tell whether this is a boy or a girl. That was before an ultrasound that could look and say, "Oh, this little what appears to be a boy really just has an extra large clitoris, and guess what? He's got a uterus, so he's not a he at all." And so the decision is made for us now because we can pursue things with medical advancements through an ultrasound, genetic testing, etc. Um, but so the whole concept of hermaphrodite is a misnomer. It has no basis in science. There's really no such thing. Nobody that I have ever heard of has both sexual parts. Worms, earthworms are hermaphrodites. They have male organs on one end and female organs on the other, but never in a mammal. It doesn't happen.
So here's a fun question for you as a doctor. You've experienced all this, and I have my own most people who are watching this already know or have heard before. Like, why is this being pushed?
That is a huge question that I do not have a clear answer on, other than there's a segment of society that fall into the anarchy realm, I think,
Mm.
where they just want to shake up and tear down the system, whatever the system is. And this is one little piece of the system that they see. It's not communism. You go to look at a communist country, look at Russia. If you were, if you came out as gay in the Soviet Union times, you were headed for Siberia and the Gulag. If you come out as gay in a Muslim country, good chance you're being put to death. In transgender, I'm sure their attitudes would be just the same.
And
Um,
China is no different on that.
yeah, exactly. So there's a complete intolerance in these other governmental systems. Um, the we have freedom. We're not a democracy, as I'm sure you know. We're a republic, but we are a democratic republic where laws are passed by decree, if you will, of the people in theory, or by
The-
lately by judges.
yeah, yeah, and our
But
elected officials who don't do what the people want
well,
them to do,
exactly,
they
exactly.
just they like
But but there's
yeah.
got to be some to answer your question. There has to be something psychologically uh, in certain people who are just want to tear down all of the concepts of what we have as a society. I don't understand it. It's radical. It's clearly an abnormal way of thinking because they're shooting themselves in the foot at the same time. But if they're talented enough, it becomes contagious in how they present it. Which brings me to something I meant to say earlier. Um, when I researched the history of transgenderism, uh, it really goes back to two individuals, strangely enough. One of which was John Stryker. He is the grandson of the man who founded Stryker Medical Equipment, certain types of orthopedic beds and medical equipment for orthopedic injuries. Um, well, he is the grandson and he's gay. He's openly gay. And he is a billionaire. And he has donated millions of dollars. Last check I knew it was like in 1 year, 58 million to various universities around the country. But it doesn't come without strings attached. The insistence of I will give you these millions if you establish diversity programs in your hospital. He's giving them to university medical centers.
Hmm.
The same thing was done by another billionaire whose name you probably know, and that's Pritzker, who is the governor of Illinois. His family have donated many millions to universities with exactly the same strings attached. And that all started about 12 years ago.
Hmm.
Yeah. Look it up. You'll find. I had to do some digging to find this, and I got it from very reliable sources. So I don't believe I'm slandering anybody. Um, but what their agenda is, I don't get it. I just totally don't get it. Um,
Yeah, I mean, there's one that's like the follow the money argument, which I think is probably part of the equation, right? Like pharmaceutical companies, if you can convince people at a young age, especially a lot of people that, that they need this, they're going to have to take these blockers for the rest of their life or whatever, if they're going to continue with that and you make a lot of money. That argument does kind of falls flat a little bit with me. There's a piece
mhm.
of that. I'm sure there are organizations that fall into that category, but I don't think that's really what's going on. It seems more like a concerted effort to take down America.
Yes, that's exactly right.
And
Anarchy.
yeah, well, and therefore it could be coming from some of those other countries that maybe don't like us so much. That might be where some of the agenda is being pushed from, but it's hard to tell. All I know is that it's evil, and we need to stop it. And we in Maine we need to push back, and we need to get sane people elected to office. Like even after all the testimony that we did, all the people that came and shared common sense things, they still like it was a 6-6 vote to like that it would. So it didn't. I guess it didn't get an ought to pass or an ought not to pass, and it's eventually going to go out to the floor. I don't know when it's going to go onto the House floor, but like the fact that like out of 12 people, and it probably would have been 7-6 against, but I don't know if you remember. You probably do.
Yeah, I watched it happen. The guy recused himself.
One guy recused himself because of his legal background, and he might, didn't want to, be seen as being compromised or anything like that. Without that, that might be 7-6 against, because that guy was a Democrat, and I think we had one Democrat come over to our side on this issue. And who knows what's going to happen on the floor, because it would have to pass the House and the Senate, where we have minorities in both. In the Senate, I think we'd need 2 people to come over, probably 4 or 5 in the House. And we need people to get on board and push, but mostly we need to get less Democrats elected, because they're almost all pushing this nonsense, which we, as you kind of mentioned, they're backpedaling away from this in other European other Western countries, because they're like the evidence is obviously against them. Whereas here in America, the Democrats, despite the fact that they lost the national election in big part, I would say, I think a lot of people were moved by the data that was coming out about this. This is one of the issues that push people outside of the Democrat Party. They don't seem to be backing away from it, especially not here in the state of Maine, where they seem to be instead, trying to, advance things even further.
Yeah, digging their heels in. Yep.
Yeah, so bad. So we really need to get. They're not going to change. And here's the thing: is if they can't figure this out, like why in the world would we trust them with anything else? Right? This is obvious.
Yes, it is.
And 80%, like, this is an 80-20 issue. In
the general populace, yes.
Yeah.
But not on party lines. They vote on party lines, which is silliness. It shouldn't be political. And, if you're elected to office, aren't you elected to represent your constituents?
Well, they see their constituents as the people who fund them.
Okay.
And the people that control that are party leadership. At least, again, I'd say that to a degree this is a problem on the right, but not compared to the problem on the left, right? Like it's just. Yeah. And so it's sad. It's crazy that we're having this conversation. In fact, to some degree, I have like fatigue. You know how like when COVID happened and everybody was on Zoom and people got Zoom fatigue? I have like boys and girls sports fatigue. Like, how is this still happening? How are we still having this conversation? How have people not opened up their eyes to the reality of the horrors of the transgender movement, as more and more people start detransitioning and telling their stories of how they were manipulated into this, parents who had their kids manipulated? Like all this stuff is like the stories are there. They're growing, more and more of them, and yet we still have so many people that are just like, their heads in the sand. They're not wanting to think about it. They're not wanting to deal with it. Well, it doesn't impact me. I don't have to worry about it. And it's just it's crazy. But anyway,
there's another factor in the general population, and that's that nobody wants to give enough time of themselves to hear the arguments one way or the other.
Yeah,
they got their blinders on, and I don't want to. No. I don't want to hear what you have to say about it, because you're not going to change my mind. I've never been that person. If there's a truth that's going to prove me wrong, please show it to me.
Yeah, absolutely. So, well, thank you so much for taking the time. Thank you for standing up. Especially as somebody who has the medical background and being willing to speak up on behalf of our girls initially, and just people in general, and caring for your patients and being honest with them even when they didn't want to. It takes a lot of courage, but I think as you kind of mentioned that, like courage. I don't know what was the term, but basically
it can be contagious.
It can be contagious. Yes. A lot of things can be contagious, including courage. And so we need more people speaking up. And so thank you again for doing that and for allowing me to reach out to you and come on this podcast, and I think testify also at an upcoming school board meeting is what I hear. So thank you so much. And thank you everybody at home for watching. One of the things that you can do to support this podcast that costs me money, if you're interested, we've got some cool merch. This is one of my favorite new hats. We also have some nice travel mugs and a number of other items. If you want to go to my new website, muddywaters.us, is a great way to get there. The other option, just for fun, is you can actually that's a old that I got to get a new QR code in here because that's for a different thing. But anyway, yeah. So go to my website, which you can also find on my X page, and get involved and just in general get involved in politics. So get involved in your local county committee or city committee or whatever it is, or reach out to me if you don't know how to get involved. Show up to school board meetings. We need engaged people. The left is highly motivated. They may have less people that are overall in terms of like people who really agree with the insanity that's being pushed there, but the people that they have are very highly motivated, and they are out there pushing their agenda, and we need people on our side, getting involved. We need, like, as conservatives and most Americans, we just want to be left alone. Sadly, the left will not allow you to be left alone, so we need to push back against them. If this experiment of representative government is going to work, this democratic republic that we have, it requires that you engage in the process. And so we need more people to get involved, encourage your friends to get involved. And again, there are going to be shorts from this. Be sure to find those. The easiest place to find them is on our new TikTok page after our first one was banned, and also our Instagram page. These are some of the best places to reach younger people, but we're also on all the other platforms. So hope to see you guys again later this week, as we've got a couple more podcasts, I believe, scheduled this week. So we'll see you then. Thanks again, Alan,
You're
for
very
coming
welcome.
on.
You're very welcome.
All right. We'll see you guys.
Keep up the good fight.
Thanks. You can stay.